What if some medical tests aren't always as necessary as you think? After the age of 60, your health becomes a priority. And while medical checkups can save lives, not every test is always needed for everyone. In fact, some tests may be overused, misunderstood, or recommended without considering your personal situation. So, how do you know what's truly necessary and what you should question? In today's video, we'll explore 5 medical tests you should think carefully about after 60 and why asking the right questions could make a big difference. As we get older, it's natural to rely more on medical care. Regular checkups, screenings, and tests become part of life, and in many cases they are extremely important. They can detect problems early, guide treatment, and even save lives. But here's something many people don't realize. Not every medical test is necessary for every person, especially after the age of 60. Modern healthcare is powerful, but it's also complex. There are guidelines, recommendations, and protocols, but these are often designed for large groups of people, not for your unique situation. Your health depends on many factors: your medical history, your lifestyle, your current condition, and even your personal preferences. This means that what is useful for one person may not be necessary for another. In some cases, tests are performed routinely, not because they are urgently needed, but because they are part of standard practice. And while this can be helpful, it can also lead to something called over-testing. Over-testing happens when medical tests are done more often than needed or without a clear reason. At first, it may seem harmless. After all, more information should be better, right? But not always. Some tests can lead to unnecessary stress, false positives, results that suggest a problem when there isn't one, can create anxiety and lead to more tests. And sometimes, those additional tests can be invasive, uncomfortable, or even risky. There's also the issue of overdiagnosis. This is when a test detects a condition that would never have caused harm during your lifetime. In other words, something is found, but it didn't actually need to be treated, yet once it's discovered, it can lead to treatments, medications, or procedures that may not have been necessary. This is why more and more health experts emphasize something important: personalized care. Instead of blindly following every recommendation, it's important to ask, is this test right for me? Do I really need it now? What are the benefits and the risks? Being informed doesn't mean refusing medical care. It means understanding it. It means becoming an active participant in your own health decisions. After 60, this becomes even more important. Because your goal is not just to detect every possible issue, but to maintain quality of life, avoid unnecessary interventions, and focus on what truly matters for your well-being. In the next chapter, we'll look at the first type of test that many people take automatically, without always realizing when it may or may not be necessary. One of the most common types of medical tests after 60 are routine screenings. These include tests like blood work, imaging scans, and various checkups that are often done every year. And to be clear, many of these tests are important. They can help detect serious conditions early and give doctors valuable information about your health. But here's the key point: routine doesn't always mean necessary. Many people continue doing the same tests every year, simply because they've always done them. No questions asked, no real discussion, just habit. But as your body changes with age, your medical needs also change. Some screenings that were useful at 40 or 50 may not provide the same benefit after 60, especially if you are healthy and have no symptoms. In some cases, repeating certain tests too often can lead to unnecessary concerns. For example, small variations in results can trigger alarm, even if they are not clinically significant. This can lead to more tests, more appointments, and more stress, without clear benefit. Another important issue is false positives. This is when a test result suggests a problem that doesn't actually exist. It happens more often than people think, and once a false positive appears, it can start a chain reaction. More tests, more procedures, more anxiety. Sometimes these follow-up tests can be invasive or uncomfortable, and in rare cases, they can even carry risks. There's also the emotional impact, waiting for results, worrying about what they might show. imagining worst-case scenarios. All of this can affect your mental well-being. Now, this doesn't mean you should avoid routine screenings completely. Not at all. The goal is not to stop testing. The goal is to test wisely. Instead of doing everything automatically, it's important to have a conversation with your doctor. Ask simple but powerful questions. Do I still need this test every year? What are we looking for? How will this result change my care? These questions help you understand the purpose behind each test. And more importantly, they help you avoid unnecessary ones. After 60, your health strategy should shift. It's no longer about doing more and more tests. It's about doing the right tests at the right time for the right reasons, because when it comes to your health, more is not always better. Better is better. In the next chapter, we'll explore another type of test that is often overused, imaging scans, and why they should be approached with caution in some situations. Imaging tests are some of the most powerful tools in modern medicine. X-rays, CT scans, MRIs, ultrasounds, they allow doctors to see inside the body in ways that were impossible just decades ago, and in many situations, they are absolutely essential. They can detect injuries, identify diseases, and guide life-saving treatments. But here's something that often gets overlooked. More imaging is not always better. Many people believe that doing more scans means being more careful, more control, more safety, but that's not always the case. Some imaging tests, especially CT scans and repeated X-rays, expose the body to radiation. Now, a single scan is usually safe, but repeated exposure over time can add up. And for older adults who undergo frequent testing, this becomes something to consider. Another issue is what doctors call incidental findings. These are small abnormalities that show up on scans, but are not actually dangerous. They might never cause symptoms, they might never grow or develop into a real problem. But once they are discovered, they often lead to more tests, more monitoring, sometimes even unnecessary treatments. This can create stress and confusion. You may feel like something is wrong, even when it isn't. There's also the risk of overdiagnosis, finding something that technically exists but doesn't require action. And yet, once it's seen, it's hard to ignore. This can lead to procedures that may not improve your quality of life, and in some cases, may even affect it negatively. Another important factor is cost and accessibility. Imaging tests can be expensive, and when they are done without a clear medical reason, they can add financial pressure without real benefit. So what's the right approach? It comes down to one simple idea: purpose. Every scan should have a clear purpose, a question that needs to be answered, a symptom that needs to be explained, a decision that depends on the result. If a scan is unlikely to change anything about your care, then it may not be necessary. This is why it's important to ask, why do I need this scan? What are we looking for? Will this result change my treatment? These questions don't challenge your doctor. They support better communication, and they help ensure that every test you take has real value. Imaging is a powerful tool, but like any tool, it should be used wisely. After 60, the goal is not to investigate everything, but to focus on what truly matters for your health and well-being. In the next chapter, we'll explore another area where caution is important: preventive tests that may not always provide the benefit people expect. Preventive tests are designed with a good intention to detect diseases early, before symptoms appear, and in many cases, they play a critical role in saving lives. Screenings for certain conditions have helped reduce risks and improve outcomes for millions of people. But here's something important to understand. Preventive tests are not one-size-fits-all, especially after 60. As you get older, your health priorities begin to shift. It's no longer just about detecting every possible condition early. It's about balancing benefits, risks, and overall quality of life. Some preventive tests may be less useful depending on your situation. For example, if a condition develops very slowly and is unlikely to affect your life in a meaningful way, detecting it early may not always change the outcome. In other cases, the treatment that follows detection may be more aggressive than necessary, and that's where the concept of benefit versus risk becomes essential. Every test has potential benefits, but some also come with downsides: false positives, unnecessary stress, follow-up procedures, overtreatment. These are not rare situations, and they can have a real impact, physically and emotionally. Another factor to consider is your overall health. If you are active, healthy, and have no symptoms, your needs may be very different from someone with multiple medical conditions. This is why guidelines often suggest adjusting or even stopping certain screenings at a certain age, depending on individual circumstances, but many people continue them automatically, simply because it's always been done, without questioning if it still makes sense. That's why communication with your doctor is key. Instead of assuming every preventive test is necessary, ask, is this test still useful for me at my age? What are the possible outcomes? What happens if we don't do it? These questions help you understand the real value of the test, and they allow you to make decisions that align with your personal health goals. It's also important to remember, choosing not to do a test is not the same as neglecting your health. It can be a thoughtful, informed decision, a decision based on understanding, not fear. After 60, health is not just about adding more tests. It's about making smarter choices, focusing on what truly improves your well-being, and avoiding what may not bring real benefit. In the final chapter, we'll look at a key principle that ties everything together: how to take control of your health decisions with confidence and clarity. At the end of the day, the most important thing to understand is this: your health is personal. No guideline, no routine, no standard recommendation can fully replace your individual needs, your values, and your priorities. After the age of 60, this becomes even more important, because the goal is no longer just to detect and treat, it's to live well, to maintain your quality of life, your independence, and your peace of mind, and that requires something powerful: active participation in your own health decisions. For many people, medical care has always been something they simply follow. The doctor recommends, and they agree. No questions, no discussion. But today, things are different. Healthcare is evolving, and patients are encouraged to be informed, engaged, and involved. This doesn't mean you should distrust doctors, not at all. It means you should work with your doctor as a team, ask questions, understand your options, know the purpose behind each test, each recommendation, each decision, because when you understand, you make better choices. One of the most important tools you have is communication. Simple questions can make a huge difference. Do I really need this test right now? What are the benefits and risks? What happens if I choose to wait? Will this improve my quality of life? These questions are not difficult, but they are powerful. They shift you from a passive role to an active one. Another important point is trust. Not blind trust, but informed trust. Trust built on understanding. Trust built on clear explanations. Trust built on mutual respect. You also need to listen to your body. Pay attention to how you feel. Notice changes. Be aware of what is normal for you and what is not. Because no test, no machine, no system knows your body better than you do. And finally, remember this: health is not just about avoiding disease. It's about living well, feeling good, having energy, enjoying your daily life. Sometimes, doing less, but doing it wisely, is more beneficial than doing more without purpose. After 60, the smartest approach is not fear-driven decisions, but informed, balanced choices. Because when you understand your options, ask the right questions, and take control of your decisions, you don't just manage your health, you own it. Outro, call to action. If this video helped you see things more clearly, don't forget to subscribe to Smart Health Tips for more simple and powerful health advice. Like the video, share your thoughts in the comments, and send this to someone who needs to hear this. Take care of your health with clarity, confidence, and wisdom.